All right. Hello and welcome to episode 6 of the Heart of Medicine interview series. Today we've got a recorded chat with Rama Prasad, who's an Ayurveda practitioner. And Jane, you actually knew Rama from doing a bit of study with him.
Yeah, that's right. I did a short course in Ayurveda lifestyle counselling back in 2012, and it just exposed me to the world of Ayurveda and its richness and depth. It's not really known here, and I think it's more known overseas in the States, but in Australia it's still relatively young.
Yeah.
And Rama was very, very good in his teaching. Very, very funny, very engaging.
Yeah.
As you guys will know when you listen to him.
Yeah.
But yeah, he really is one of the leading teachers in Ayurveda. We had a fantastic time talking to him, didn't we?
Yeah, it was interesting the way he saw the interconnections between all the ancient medical traditions.
That's right.
How they may have been, the language may have been changed to suit the culture and the country, but really there's some core principles that run through everything.
Each one. Yeah, so, you guys will find some similarities and differences between TCM and Ayurveda.
And other medicines as well,
Yeah, so this is just a fantastic exposure. What else was really insightful was his education.
Yeah, his learning experience.
Education process.
And how intense that was.
Yeah.
Yeah. Very humbling. Like, he was reciting thousands of lines of text. And,
in Sanskrit.
Yeah, in Sanskrit as well. And,
yeah.
And then even when he came out of 7 years full-time study, sort of like,
I know nothing.
Yeah, I know nothing. Does it work? I don't know. I have to find out.
Yeah. And then he talked about the experiences with his first mentor. And how that really changed his experiences as a student and as a practitioner.
Yeah.
So that was really, really funny.
And what a character his first mentor was. He shares some funny stories about him. That's good.
Yeah, so that's basically how this part 1 will wrap up.
Yeah.
And part 2 will be...
flow on from there.
Yeah, will be released in 2 weeks. So hopefully you guys will enjoy this one, and we'll see you part 2.
Enjoy.
Yeah, so having done acupuncture, we learned the traditional Chinese medicine system through it.
Yeah.
And there are some similarities and differences, obviously.
It's mostly in the linguistics to start with, and then it comes to the application, because culture is different, right? So, according to some of the historians, Ayurveda went to Tibet, then to China, to Japan. So you see the similarity everywhere. But I think there was a lot of giving and taking. It's not just giving. There's a lot of giving and taking. And at that time, I think people communicated much better, in a much better way than we do today.
Yeah.
Because we lose a lot in interpretation. What is the translation?
Yeah.
There, they didn't. So they say from India, Ayurveda went to Persia and that way as well. So when you compare all these systems, you come back to the same kind of principles, like 5 elements and 3 forces, like Qi, Yang and Yin. They all come back to the same thing, but the way they use work is slightly different to suit their culture, language and geography.
Okay.
So it's a common root.
Common root. In European medicine, Greek medicine, they talk about bile and phlegm and wind. And they took the Vata Pitta Kapha in a different way.
Oh, really?
Yeah, wind. When they talk about wind, they're not talking about burping and breathing. They're talking about the winds in the body.
Ah.
So the currents in the ocean is a wind.
I see.
So when the tornado or the kind of spiral, that's a wind.
It's a wind nature.
Yeah, means movement, and that's Vata. And bile is the most obvious Pitta thing. So they just use this as a symbolic rather than bile as bile. Same thing happened all over the world, and when you compare the superficial stuff and you lose all the essence.
Yeah.
But when you sit down and look at it, it's the same stuff. Qi, Yang and Yin, that's Vata, Pitta and Kapha in their way.
Yeah.
And even when you look at the how they function, it's the same stuff.
Yeah.
Vada is the ultimate Vada function is enthusiasm. That's a sign of pure energy, chi.
Yeah.
And five element got again transformed or modified in each place. Chinese five elements is completely different from Indian five elements.
Yeah.
There was a reason. That's it.
Actually, expand on that a little bit, because that's an area that a lot of us get confused in.
Yeah.
So because I've learned under you,
The moment you mix the Ayurvedic stuff and Chinese stuff, you're done.
Yeah. so explain.
No,
for us.
I can't explain the Chinese stuff because I try to understand
Ayurveda
it.
stuff.
Ayurveda stuff is very simple.
Yeah, you go. Because
Ayurvedic view on element is this. Okay, Ayurveda has got many principles.
Yeah.
Each principle is a language. Each language is capable of describing certain things in certain ways. There's no one complete language. So Ayurveda developed many languages so that we can get a good grip on reality called life. Typical example I give is we started studying modern science.
Yeah.
We started studying about things. And we started gravity, flexibility, malleability, or fluidity. We call it physics. And then we started seeing, in living things, physics is different. It's called chemistry. Inside the physical material, there are things changing, and that's called chemistry.
Yeah.
And in a living material, the physics and chemistry behave slightly differently. It's called biology. So more we start looking at it, so we got this physics, chemistry, biology. Then we realized, it's not really just three watertight compartments. It's like biochemistry. We started developing new ways of looking at stuff. Chemobiology, chemophysics, physicochemistry, biophysics. Physicobiology is still in the oven again. It's basically we are trying to get a good grip on reality.
Yeah.
And the more we see from different angles, we come up with. So, is physics complete? No, it talks about the physical nature of the universe, life, or chemistry. Chemistry describes certain aspects. So, similarly, Ayurveda, came up with these views on life, and each became a language. Instead of becoming a huge book, it became 3 words or 7 words or 5 words. But the more you explore these 3 words like Vata, Pitta and Kapha, we call it dosha, means biology. Dosha comes from the word dusha. Dusha means transformation or change, remake, reform, restructure. That's biology. So we use this to categorize everything into 3 groups. Before that, another understanding came out. Everything is made of 5 forces or energies. Gravitational force, electromagnetic force, thermodynamic, kinetic, and everything works with some kind of understanding, knowledge, information. Why does electron behave the way it does? Not like proton. Why does hydrogen atom behaves like hydrogen atom, not like oxygen atom? Why do they do the same exact thing in the same exact environment? They realized that's the wisdom with which it's built. So they came up with these 5 understandings. Gravity, electromagnetic means ability to be bond together, and when you split it, it's called explosion, fire. So we started calling earth, water, fire, air, ether. So it's not the earth we are talking about, the dirt. This is one way of categorizing everything. Then came up with other things like sattva, rajas and tamas, the modes of the universe. Everything has got wisdom, it's active and inactive. Action, inaction. Intelligent action and inaction. So these are the 3 modes, sattva, rajas and tamas. Rajas is action, tamas is inertia, and sattva is awareness or consciousness or pure information or knowledge or data. But when we get into more words like consciousness and awareness, that's when we lose the plot completely. Because most of us, we don't really define it. If we don't define, we are talking about 2 different things. But the Vedic approach, just like yoga is a part of Veda and Ayurveda. We start with a definition to each word.
Yeah.
So we establish a definition means this is what I'm talking about.
Yeah.
This is the zone. This is the place. This is the idea. Then we talk about it. So when we start with the definition, it's all easy. Anyhow, so Sattva, Rajas, Tamas is another way of looking at life. So which mode are you in? Action mode or inertia mode? You need to have an inertia mode. Otherwise, say you don't sleep, you can't act intelligently. To act intelligently, you need to rest really well.
Yeah.
And if you don't act really well, you can't rest really well. Try that. All day you're watching TV, you can't sleep that night because you didn't act enough. So they're all working together. So that's one way of looking at it. None of them is completely perfect. It describes one aspect of life. Then when it comes to the body, we talk about it's all the same energy, but it behaves differently. So we came up with this understanding of there are 7 subtle tissues. So rasa, rakta, mamsa, medas, asti, majja, shukra. There are 7 subtle tissues. It's based on their function. So what is that? Prinanam, jivanam, lebo, sneham, dharana, puranam, garbholdpada. Prinanam means satiating, nourishing in the medium of fluids. So fluid function. Without, think about it, there's no life without water.
Yeah.
So water is the medium of life. You take water out, it's dead, or it's frozen or dehydrated completely. So that's a fluid function. Raktam means its function is jivanam, invigoration, enlivening. So this is the beginning of actual. So water is there, then the life functions start.
Yeah.
Jivanam, lebo. Then the tissue in the body, you need to keep it together. Lebo means pasting, covering. So on a physical level, mamsam is the muscle.
Okay.
Yeah.
So muscle covers up the joints and innerwear, and they work together by pressurizing each. Jivanam, prinam, lebas, prinam, leba, sneho, lubricating, oleating. Without oil, nothing happens. Take the oil out of your diet, brain stops functioning. Nothing goes into the brain, so oil makes sure everything is well lubricated. Sneho, dharma. Holding your body in erect pose, that's another thing. Without bones, it's impossible. But your body's ability to be vertical, that's skeletal tissue, subtle skills we are talking about. Think about a cell. It doesn't have any bones in it, but it holds the layer of the cells at the bottom of your feet holds the entire body, 60 kilos, without getting squashed and crushed.
Yeah.
So they have got that ability of subtle bone, skeletal tissue. So that's how the whole concept was built.
Yeah.
So when it comes to the body, tissues are much more, tissues make sense. Dhatus, we call it dhatus. That language makes sense. When it comes to the classification, let's keep it simple, 5. We want to make it really simple, 3. And when it comes to activity, mental, physical activity, let's keep it 3, sattva, rajas, and tamas. So we are playing with these 3 things. They are all, there's no one language that describes everything. We need to use the right language. It's just like playing cricket. If you're a keeper, you need to have your equipment. Batsman, different. Bowler, fielder, they're all using different equipments. So in the clinic, you'll be using different equipments in different contexts.
Yeah, right. So it sounds like it's incredibly important to get those initial sort of foundational concepts really honed in and understood before you can expand on anything else.
You need to get that definition clear in the head, and then still you don't have a clue. So in the clinic, the teacher will show you, okay, this is what's happening, this is what's happening. That's a mind-boggling time. It's like you go home, you can't sleep because you're so excited because you saw it. Once I remember, this was a clinical situation. 2 5-year-old kids with the same disease, worms. So the teacher said, I'm going to show you 2 different treatments, completely different treatments, and see what happens. one was given a treatment where the environment that nourishes worms will be completely removed, so the worms should disappear.
Yeah.
The other one was given a worm flush.
Yeah.
The second boy who had a worm flush, next day flushed all the worms. It took a month for the boy to recover from everything and become back to normal. He was on herbs as well.
Yeah.
The second one was given certain herbs and in a nutrition program to remove the environment so worms can't exist. Within a month, there's no worm.
Yeah.
So there are two different ways of, there are many ways of dealing with the same health condition.
Yeah, interesting.
So that's when you start seeing, so it works.
Yeah.
So you need to see that in the clinic. That's when you get the excitement. That's where the theory is seen in practice, in action.
Yeah. Right. And so, what are the different scopes of Ayurveda, like
The different branches. Or
yeah,
something.
different branches and
Scope of practice.
There are different. If you travel from north to south and east to west of India, you will see people specializing in a particular disease. They only treat hepatitis or arthritis or just bone issues or musculoskeletal issues. But some other schools are specializing in certain herbal preparations.
Oh, okay.
So some schools only use minerals and metals, oxidized, and so there's no heavy metal in it. The others just herbs, and others are specializing in cleanses and therapies.
Yeah.
So they use all these things, but focus is specifically.
okay.
So speciality, there are 8 major branches in Ayurveda.
Yeah.
Kaya, Bala, Graha, Urdhva, Anga, Shalya, Damshtra, Jara, Vrasha, 8 major ones. General medicine, pediatrics, Urdhva, ear, nose, throat and ophthalmology. Kaya, Bala, Graha, Urdhva, Anga, Graha, psychiatry, Shalya, surgery. We don't practice it anymore.
No.
Shalya, Damshtra, poisons, toxicology.
Wow.
Geriatrics. It's not quite geriatrics. Yeah, it is geriatrics. It's more like rasayanam, age stabilizing. It's not geriatrics. More like age stabilizing. So you're 30 and you feel like 30, you're young.
Yeah.
You're 30 and you feel like 31, you're old.
Wow.
So that's a modern concept of biological age.
Yeah.
So you're 40 and biologically you're only 26, you're young.
Yeah.
So that's good, so you can get younger and younger with a proper diet and lifestyle and way of thinking. So that's one. And last one is Vrisha Chikitsa or Vajikarana Chikitsa. It's a fertility therapy.
Okay.
And fertility therapy is crazy because, I don't know, recently they discovered the child's gender is not determined until its 3rd or 4th month. That's a very recent understanding. 6,000 years back, they used to use fig sprouts to determine a child's gender.
Yeah.
So, say you got 5 boys, you want a girl. And the Ayurvedic doctor would say, when your wife is pregnant, bring her over, we'll give you what you need.
Yeah, right.
And usual medicine is this: fig sprouts, the fig tree, and the leaves sprouts, or 3 of them crushed, boil it with milk, and let her drink it in the evening, and ask her to put 3 to 8 drops in her left nostril
Okay.
for 21 days. Left nostril girl, right nostril boy.
Okay.
And you go, this is full of bullshit. Every single time you get it right. So when the urine test is positive, it'll be like 3-4 weeks max.
Yeah.
In the second month, for 3 weeks, they do this fig milk in the nose and mouth treatment.
Yeah.
Somehow it works.
Yeah.
Yeah, right.
And whenever I presented it like 10 years back, they said, no, gender is determined soon after fertilization. Yeah. And then 10 years later, now, it's like, the gender is not determined. So the point is how much do we know?
Yeah.
and how much did they know at that time.
Yeah, yeah.
When iron was prescribed 6,000 years back, it was always with honey and lemon juice. Around 100 years back, they discovered, iron needs vitamin C. Wow, that is a big discovery. We were doing that all the time. We don't know how they've discovered that.
Yeah.
They talk about, Ayurveda talks about six layers to the skin. Actually 7 layers.
Okay.
7th layer is the connective tissue.
Yeah.
If you look at the names and functions and look at dermatology, the latest dermatology book, compare it. 6,000-year-old book versus the latest book, it'll say 6 layers and a connective tissue. And each layer is the same. One is blood, one is nerve, the other one is something else. Exactly here.
Yeah, right.
Unbelievable.
And they talk about actually the body unit is called Sharira Paramanu. That's a word for cell. Sharira Paramanu means the basic unit of the body, the cell.
Unbelievable. So did you, when you were in your education, did you guys have to learn a lot of the classics, or did you have to do that
Oh man!
on your own time?
So when I sing, Kaya Bala Graha Shella Demstra Jara Avashe, there are 2 lines from 100,000 lines. 200,000 lines.
Wow.
You just learn it. So that's an exam. In the exam, they ask you a question. So you answer prose. They go, no, sing it. So sing it. That's no, sing it. So quote it. That's what they're saying. Quote it. You need to quote one of the 3 books. If you don't quote, okay, that's the door. You're stuffed. Wow. So we used to learn the entire chapter, like 400 lines.
To memory?
To memory.
Wow.
Rote learning, right?
Rote learning. It's basically installing Microsoft Word onto your computer. What do you do? That's rote learning.
Yeah.
You're putting every byte onto your hard drive.
Yeah.
Now you can open a Word document just like that.
Yeah, right.
Without that, every time you need to open a Word document, you need to reinvent the wheel.
Yeah.
So when we learn a herbal compound, we just learn the song.
Yeah.
There's a compound called Hinguvachadi. Means it's every compound starts the name of the every compound is starting with the first 1 or 2 or 3 ingredients.
Yeah.
And Adi means starting with these 3. So Hinguvachadi. Hingu means hing, the spice called hing, asvatida, and vacha is Acorus calamus. It's a brain tonic. There's a compound called Hinguvachadi. So you need to learn the song. So what happens after 70 years? You still remember the ingredients.
Yeah, right.
Hinguvaja Vijaya Pasidantha Dadime Deepika Dhanyaga Patha Pushkaramura Shati Hapushakya Chara Yuga Tripatuni Sajaji Chabyam Sahatintranigam Savedamamlam Mini. So all these 19 ingredients.
Wow.
And the indications you need to learn it.
Yeah.
Parsha Kukshik Trigayoni Pai Shulani Vaivama Kapod Bhavani Krichran Gulman Vadabin Mutra Sankham Kandhevantham Krudrujam Mutra Grucham Annas, it goes like that.
Yeah, right.
So once you study it, you have installed it.
Yeah.
So it's all back, so you sit in the clinic, teacher sits there, okay, recite the first chapter of this, okay. Recite the first chapter of this herbal stuff, okay. Can you see it? I can see it. So the clinician is linking a clinical situation to all these textbook stuff in your head.
Yeah, right.
And by the end of 2 years, it becomes automatic.
Sort of like the Karate Kid, wax on, wax off.
Yeah.
Exactly.
You just know what to do.
Exactly.
Yeah.
When I used to watch a lot of karate kind of movie like Jackie Chan, and that's what I felt. Wow. In the beginning, the teacher doesn't say anything. He's just beating the crap out of him, and gradually he goes,
I get it.
There's a pattern in that madness. Okay.
So it's quite sudden that you get.
Yeah, click is so sometimes it can take a couple of years.
Yeah.
Because sometimes it's a process, sometimes it's
It would have been frustrating though as a student.
Oh yeah.
Going through 7 years, was it? 7?
When I did it, it was a 7.5-year training.
Yeah.
Because they didn't want to teach us 5.5-year training because there was too much to learn in 5.5 years. So they put few stuff into 2 preliminary years. They taught botany, degree level botany, chemistry, physics, biology, English, Sanskrit, yoga.
Oh, wow.
Oh.
And we used to get visitors. They look at the syllabus. They go, "Oh my God! So you spent 5 years on it. Now we spent 2 years on it." They just stop talking. What happens after 2 years?
Yeah.
Oh, this is the syllabus for that. They just leave. Because we had to learn Ayurvedic stuff and the modern medicine.
Yeah,
Of course.
Because
You have to be able to integrate it.
yeah.
Yeah.
So you get an idea about what's going on in the other camp.
Mm.
Otherwise, no one talks Ayurvedic language. They talk
No.
about inflammation and infection.
Yeah.
So you need to get some understanding about that. We didn't learn that modern therapeutics. We learned the physiology, anatomy, etiology, pathology, so it's all the theory part of modern science as well, along with the Ayurvedic stuff. So it was kind of exciting and miserable at the same time.
Did you have any teachers external to the university?
Yeah. After all these things,
Yeah.
I realized I don't have any clue. I mean, that's a normal thing because the amount of information pumped into your brain, it just feels like, so I never felt how I knew. So I spent a year with my teacher. The goal was how do you deal with people? Because I didn't know, they didn't teach the psychology, consultation psychology, how do you, we consulted, but just as mechanical.
Yeah.
I want to know how to deal with real people in a nice way.
Yeah.
So I spent, along with that, I want to know whether Ayurveda is practical and whether it is effective and how do you deal with it in a non-college, non-university style.
Yeah.
This guy here never went to school. No degree, no diploma, nothing. And he was seeing 120 patients a day.
Whoa.
Alright.
The system was fantastically different. He'll have 5 Ayurvedic doctors in there and 3 benches there with around 15 patients on them. And he sits in the corner in an easy chair, legs up, and beetle leaves, chewing beetle leaves is a kind of normal thing people did. Not these days, it's more like smoking and drinking and going crazy.
Yeah.
Beetle leaves, technically it is a dental gum kind of tonic. Anyhow, and he goes, "Yeah, why are you here?" The first patient goes, "I got amenorrhea, I got constipation, when I poop it's smelly," and the whole personal stuff comes out, and everyone acts, "Oh no, that's what they do,
Yeah.
And he goes, "Okay, doctor number 1, these are the medicine, these are the dosage, these are the timings, write it down. Okay, next patient." So while he's doing that, it takes, consultation takes 3 minutes.
Yeah.
Wow.
Writing stuff takes 10 minutes, 15 minutes. Because he needs to write it down in short and expand it properly. Any inaccuracies, his scanning is fantastic. It's like, Anyhow, that was his style. 120 patients a day. So in the first 3 months, I was like in a shipwreck kind of situation. Like, what's going on?
Yeah.
A total waste of time.
Yeah.
Then I started realizing, it's bloody working. And his style is different. I don't want to deal with his, copy his style, but Ayurveda works.
Yeah.
And dealing with people, he had his own style. No, I don't want to copy it, but now I can, develop my own style.
Yeah.
Yeah, right.
He was so ruthless, rude, and totally careless. But when he came to the treatment, to the point, clear, precise, control freak.
Yeah, right.
And everything else was like, once he decides, that's it.
Yeah.
Once he finishes his consultation at 5:30, 5:25, he goes, Mohan is his assistant. Mohan, 5:25. I don't want any more. That's the meaning. 2 more people? No, 2 more people, just 1 more and that's it. In front of all these people.
Yeah.
Straightforward.
Yeah.
And he didn't need any consultation fee either, but he got more money than normal people because he didn't need it.
Yeah. It must have been that good.
Yeah.
Anyhow, he got out at 5:30. Here comes a guy. Can I see you? He said, yeah, he can see me. No, consult you. Oh, 5:30 tomorrow morning at 9:30. I'll be here. He said, I was traveling all day to see you. And he goes, should I start early? He said, I'm the education minister. And my teacher goes, I'm Vaidyamattam, that's his name, surname. Yeah. Vaidyamattam, that's his last name.
Yeah.
And the guy said, the minister said, I know that. And he goes, then what are you talking? No, I'm the minister. I was traveling all the way. He said, you could lose your place tomorrow morning, you know that. So you won't be a minister anymore. But tomorrow, even tomorrow, until I die, I'm Vaidyamattam.
Yeah.
So the meaning is, don't try to scare me with your position. If you want to see me, 9:30 sharp tomorrow. Book in. If you don't book, you don't come to. You don't see. He was very. He respected his time, space, everything. That's it.
Right.
And it sounds like, looks like it's really rude. No. If he doesn't rest, he come back tomorrow morning all tired.
Yeah.
He wants to give 100% every single minute. And he had that idea very clear.
Yeah.
I couldn't believe it. This is a minister.
Yeah.
He could do so many bad things for this guy.
Yeah, that's right.
I said, you could be not a minister tomorrow, but I'll be still Vaidyamattam.
Yeah.
That's a fantastic
That's a great
phrase.
line. That's a great line. So I suppose that kind of discipline and his approach, that was your biggest takeaway with him.
Yeah. I mean, the first rule, I don't want any money. I'm not treating you for money.
Yeah.
Here you go. Suddenly, what is in your court? You want to get treated? You want to get better?
Yeah.
I'll try. I'll try my best.
Yeah.
That's awesome.
So when you are in that position, life is completely different. There's no competition. There's no stress. There's no tension. Yeah, first few years you'll be stressed out because there's no one coming in. People think you're weirdo, and then things change. One person will go, oh, you know what? The guy is very to the point.
Yeah.
And one patient, after all this chastising, goes home, starts taking treatment. Next day or next month, he's going to come with a mini van full of patients.
Oh, wow.
That was a regular thing.
Jeez.
He used to get patients. The one patient goes and brings rounds up all the patients in that area, puts them in a truck or bus. Come on, everyone, one after the other one. 120, that's a maximum.